Policymakers and healthcare providers can celebrate one quiet success in the wake of the Houston storm. The computers are still running. The preservation of patient health records represents a partial vindication for the HITECH Act, the 2009 EHR stimulus package that was conceived, in part, as a way to ameliorate natural disasters like Hurricane Katrina by replacing waterlogged paper with modern technology. Story continued below. Now comes the hard part: using IT to manage the health of patients whose lives will be disrupted and scattered by the storm. Several Houston hospitals contacted by Politico, including MD Anderson, Houston Methodist, and Texas Children's, as well as area providers, said their EHRs and technology had functioned without pause through the deluge. "We are doing well," said health IT researcher Hardeep Singh, who was working at Houston's Michael E. DeBakey Veterans Affairs Medical Center during Harvey. "Only thing needed is food for residents, and I'm about to go pick up some pizza for them from the only shop we found open." Singh's calm was shared by the other providers, who reported uninterrupted connectivity throughout the storm. Texas Children's had a close call. A leaky closet could have imperiled the organization's communication equipment were it not for some well-deployed sandbags, said the organization's CIO, Myra Davis. The intact records represent a success for HITECH, which passed partly as a response to Katrina, the devastating 2005 storm that left healthcare systems struggling to manage patients blown across the country. Their medical records, often destroyed by flooding, did not follow them. Before Katrina, the costs of EHRs seemed prohibitive, former Surgeon General Regina Benjamin wrote in a 2010 New England Journal of Medicine article. After the storm, she changed her mind. "Whereas I had previously decided against installing an EHR system because I couldn't afford one, I now realized I couldn't afford not to have one," she wrote. During Katrina, the nascent ONC collaborated with state Medicaid and Blue Cross Blue Shield organizations to create a site, katrinahelp.org, which used claims data to provide doctors some information on patients' drug regimens and medical history, said David Brailer, the ONC's chief at the time. "By signing up, you agree to receive email newsletters or alerts from Politico. You can unsubscribe at any time." The website was helpful, and the experience of Katrina was one of the paving stones on the road to HITECH. "It was one of the first times we were able to demonstrate to the public why their electronic information was important," he said. Legislators frequently cited Katrina while designing the HITECH Act. The VA, with its pioneering Vista EHR, was able to retain records and access them much more rapidly than its private sector peers during Katrina. A September 2005 VA magazine pointed out that the organization restored access to records from 40,000 New Orleans area veterans within days. It would take years for the private sector to reassemble its records. The vast records ended up being widely used by Gulf Coast natives and diaspora. Their records were accessed by doctors in 48 different states, a 2007 American Journal of Public Health study showed. This time around, IT specialists in the private sector were ready. In Houston, continuity preparations began years before Hurricane Harvey. When Houston Methodist built its data centers 6 years ago, it made sure they could withstand hurricane-force winds, said Robert Eardley, the hospital's chief information officer. A steel lattice roof was erected to protect electric generators powering the center, which also has a backup data center in Austin. MD Anderson also has a backup center 60 miles outside Houston, said Craig Owen, the system's interim CIO. Indeed, 70% of U.S. hospitals now have cloud-based backups for their data, a recent American Hospital Association survey found. Some providers have gone all the way to the cloud. Dan Jensen, Chief Financial Officer for Village MD Houston, a population health organization partnering with 11 primary care clinics in Houston, said that Athena Health, the system's cloud-based EHR, enabled the clinics to access their EHRs through a phone app if internet servers crashed. Davis, of Texas Children's, said that staff tweaked the login procedure during the storm. Ordinarily, doctors who don't log in for 90 days have to undergo complex procedures to regain their privileges. With normal scheduling of doctors out the window, the 90-day rule was eased. The next big test of the region's EHRs, meanwhile, is to see whether they have enough interoperability to make sure patients scattered by the storm, and their new doctors, can access their records. Brailer is pessimistic. "It's no easier to put together a database for emergency response now than it was then," he said. "Identifying high-risk patients requires good data, and ensuring that that data gets to the right persons requires easy transfer. Both tasks have proved challenging. My prediction is that there will be a bump in non-disaster deaths that arise from discontinuity of care," he said. "God forbid that will happen, but it's happened every time we've had a disaster. Many people have missed a treatment. Katrina, for example, disrupted treatment for thousands of people. Most if not all diabetic patients lacked records of their care when they were evacuated to shelters, forcing doctors to select their drugs based on what was available. Cancer care was also problematic. A doctor quoted in a Time magazine article said he couldn't tell whether a lesion in one patient's lung was new or not. The patient would probably have had a little bit longer and better quality of life with continuous care, the doctor said. Houston providers contacted by Politico this week, however, said they were using EHRs to do the vital electronic triage work required by the storm. MD Anderson did 50 chemotherapy infusions Tuesday, Owen said, after the IT staff used data to identify patients most in need of that treatment. The center canceled many appointments but hoped to fit in the most at-need patients over Labor Day weekend. As for patients forced to leave Houston on an indefinite basis, MD Anderson could share data through its Care Everywhere platform with other Epic providers. If it's not an Epic hospital, we would have to work with them to transition information, Owen said. The storm doesn't seem to have hurt information exchange for her hospital, said Sarah Madam, an executive with Texas Children's with responsibilities in emergency response. Before the storm, Village MD called, sent text messages and updated social media to advise high-risk patients about clinic availability and to inform them of a doctor's call-in line, Jensen said. Village's clinics are beginning to reopen, with walk-in availability, and care managers are reaching out to make sure fragile patients have medications they need, Jensen said. The federal government is also stepping in, noted Karen DeSalvo, who as New Orleans Health Commissioner used Medicare and Medicaid claims data in the wake of a 2012 hurricane to identify patients on oxygen or dialysis. The city contacted them before the storm and tried to expedite the restoration of power to their neighborhoods. The program was later adopted by HHS as a whole. That program, called Empower, has continued. Under HHS Secretary Tom Price, she noted. I was so happy to see it was still being used, she said. Some near 12 years ago, we were living in such a different world, she said. Correction: an earlier version of this report misstated Dan Jensen's title. He is the Chief Financial Officer of Village MD Houston.